Hello students, welcome to Pharma Syndrome YouTube channel. In this today video, we will discuss regarding the MCQs with explanation regarding sedatives and hypnotics. Sedatives and hypnotics are mainly useful for the purpose of insomnia, the condition in which the person is unable to take the sleep. And apart from that, the sedative hypnotics can be used in the treatment of epilepsy, can be used in the treatment of anxiety and further disease also. And here our main motto, explanation regarding MCQs with which answer is right and which answers are wrong and why. And let's enter into the first MCQ. Sodium bicarbonate is an antidote for the overdose of. The options are benzodiazepines, barbiturates, rameltian, all. And the answer is barbiturates. Why? Because chemically the barbiturates are weak acids. And if barbiturate dose become higher, it leads to acidic poisoning. So to neutralize that acidic poisoning, we have to give the sodium bicarbonate. We have to give the sodium bicarbonate. And the antidote for overdose of benzodiazepines is flumazenil. Flumazenil, that is the antidote for benzodiazepine overdose. And rameltian is a agonist at the melatonin receptors, which is used in the jet lag. And here jet lag means the persons who are suffering from the insomnia because of shift works. Somebody having the night shifts, somebody having the day shift, like that. In that condition, there is a chance of alteration in the sleep cycle. So rameltian is not related here. The answer is benzodiazepines overdose antidote is the sodium bicarbonate. So sodium bicarbonate is the base and barbiturate is a weak acid. And next, inhibitory postsynaptic potential is produced by the and here examples, nothing but options are beta alanine, glutamate, NMDA, AMPA. And here answer the beta alanine because GABA, glycine, beta alanine, these are inhibitory neurotransmitter in the central nervous system, and these can produce inhibitory postsynaptic potential. అంటే ఈ న్యూరో ట్రాన్స్మిటర్ అంటే బీటా ఎల్ఎన్ కానీ గాబా కానీ గ్లైసిన్ కానీ రిలీజ్ అయితే అవి పోస్ట్ సినాప్స్ మీద ఇన్హిబిటరీ సిగ్నల్స్ ప్రొడ్యూస్ చేస్తాయి. అండ్ గ్లూటామేట్, aspartate, NMDA as well as AMPA are comes under the category of excitatory neurotransmitter. So here answer is beta alanine. GABA, glycine, beta alanine are inhibitory neurotransmitters in the central nervous system. Glutamate, aspartate, NMDA, AMPA are excitatory neurotransmitter which can produce as excitatory postsynaptic potential. And next question is sedatives hypnotics are also known as options like major tranquilizers, neuroleptics, minor tranquilizers as well as nootropics. And the answer is minor tranquilizers. So minor tranquilizers is other name of sedatives and hypnotics. Why? For example, major tranquilizers and neuroleptics is other names for the antipsychotics, drugs for treatment of psychosis. And nootropics meaning is the agents increase the memory. Sorry. So nootropics means the drugs are agents used to improve the memory. That is nootropics. And minor tranquilizers is a synonym of sedative hypnotics. And major tranquilizers or neuroleptics are synonyms of the antipsychotics, drugs for the treatment of psychosis. So why antipsychotics called as major tranquilizers? In the psychosis, the person behavior and thought is irregular, abnormal behavior and abnormal thoughts. We are unable to control. అంటే సైకోటిక్ పర్సన్ యొక్క బిహేవియర్ మనం కంట్రోల్ చేయాలన్నమాట. అంటే హైలీ ఎగ్జైటబుల్ గా సైకోటిక్ లెవెల్లో ఉంటుంది కాబట్టి అంత హైలీ ఎగ్జైటబుల్ హై లెవెల్లో ఉన్న పర్సన్ ని మనం కిందకి తీసుకురావాలి కాబట్టి మేజర్ ట్రాంక్లైజర్ tranquilizer is a substance used to calm down the person. For example, atropine is a opioid derivative of the morphine used to tranquilize the elephant. అంటే ఎలిఫెంట్ ని ఏదన్నా వెటర్నరీ డ్రగ్ ఇవ్వాలన్నప్పుడు ఎలిఫెంట్ ని కంట్రోల్ చేయాలంటే అటార్ఫిన్ ని తీసుకుంటారు. సో దాని పేరు మీదుగా అటార్ఫిన్ ఏ డెరివేటివ్ ఆఫ్ మార్ఫిన్. అండ్ అటార్ఫిన్ ఈస్ 1000 times మోర్ పొటెంట్ దాన్ ద మార్ఫిన్. అంటే ఎలిఫెంట్ అనేది పెద్ద యానిమల్ కాబట్టి దాన్ని కంట్రోల్ చేయాలంటే అంత డోసు కావాలి. అలాగే ఇక్కడ కూడా సైకోటిక్ పేషెంట్ ని కంట్రోల్ చేయాలంటే అతన్ని బాగా హై స్టేజ్ నుంచి కిందకి తీసుకురావాలి. అందుకని మేజర్ ట్రాంక్లైజర్స్ అంటారు. మరి సెడేటివ్ హిప్నాటిక్స్ మైనర్ ట్రాంక్లైజర్స్ ఎందుకు అన్నారండి? సో సెడేటివ్ హిప్నాటిక్స్ ఎందుకు వాడుతున్నారు? నిద్ర సరిగ్గా పోని వాళ్ళు నిద్ర పట్టడానికి వాడుతున్నారు అనమాట. సో అది చిన్న పనే కాబట్టి మైనర్ ట్రాంక్లైజర్స్. సో దట్ ఈస్ the other name of sedative and hypnotics is minor tranquilizers. And next, which of the following is a jet drug? So what is the discussion here regarding next MCQ? Which of the following is the jet drug? So here, if you observe in the sedative hypnotics classification, there is a jet drugs are there like zolpidem, zolpidem, zopiclone. So if you observe clearly, the answer is zolpidem and triazolam, flurazepam, midazolam are comes under general benzodiazepine, and zolpidem, zolpidem, zopiclone are called as jet drugs. They are called as jet drugs. And these jet drugs called as non-benzodiazepines. Both benzodiazepines, non-benzodiazepines having the same mechanisms binds to the GABA A receptors and produce the sedation. And next question is melatonin receptor agonist. Melatonin receptor agonist. So the correct answer is Rameltian. Rameltian with the brand name Zitlag, which is a agonist at both melatonin 1 and melatonin 2 receptors. You know, melatonin is a sleep producing hormone, and melatonin 1 and 2 receptors are comes under G protein coupled receptors. And nitrazepam is a general benzodiazepine, and the serotonin, you know, it is a neurotransmitter, and the thiapental sodium is a ultra short acting barbiturate. Ultra short acting barbiturate. And next question, GABA A receptors are GABA A receptors are GABA A receptors are comes under ion channel category. So you know ion channel in the receptors, ion channel receptors, G protein coupled receptor, enzyme linked receptor, nuclear receptor. So the correct answer for GABA A. So GABA is a gamma aminobutyric acid, which is an inhibitory neurotransmitter in the CNS. There are three types of GABA receptor: A, B, C. A and C comes under ion channel. GABA B comes under G protein coupled receptor. So GABA A is ion channel receptor because when GABA A receptors are activated, conduction of Cl minus ion. So ionotropic or ion channel receptor. And enzyme linked, also known as catalytic receptors. Here no linkage of ions. Nuclear receptors, also called as steroid receptors, or cytosolic receptors, or intracellular receptors. Here in the nuclear receptor, there is involvement of steroids as well as vitamin A and D, also thyroid hormones. And G protein coupled receptors, also called as metabotropic receptors. So GABA A receptors are ion channel or ionotropic receptor. Next, which are long-acting barbiturates? Which are long-acting barbiturates? So here the correct answer is the long-acting barbiturates like mephobarbital as well as phenobarbital used as a anti-epileptics. Used as a anti-epileptics. So the long-acting barbiturates are used as a anti-epileptic, and ultra-short-acting barbiturates used as a general anesthetics. General anesthetic. And also some of the barbiturates are used as anxiolytics, and some of the benzodiazepines like diazepam used as a muscle relaxant. So long acting barbiturates are used as a anti-epileptics. Like examples like mifebarbital, phenobarbital. And short-acting barbiturates are secobarbital and pentobarbital. Short-acting barbiturates are secobarbital and pentobarbital. Ultra short-acting barbiturates are thiopental sodium. Thiopental sodium. Sorry. And next question. Narcolepsy is also known as. So narcolepsy is also known as a insomnia means person unable to sleep అంటే నిద్ర సరిగ్గా పట్టకపోవటం. నార్కోలెప్సీ అంటే ఎక్సెస్ స్లీప్. ద పర్సన్ ఈజ్ ఇన్ 100 కంటిన్యూస్లీ ఇన్ ద స్లీపింగ్ కండిషన్ అంటే పూర్తిగా నిద్రలో ఉండడం. సో ద ఆన్సర్ ఈస్ ఎక్సెస్ స్లీప్. Excess sleep also known as narcolepsy, the condition in which the person fall into sleep during studying, during walking, during eating, during driving. And schizophrenia is incorrect because of schizophrenia also known as psychosis. And Parkinson's, which is a neurodegenerative disorder. And Huntington's chorea is also a type of neurodegenerative disease in which case GABA levels are decreased. And domination of dopamine in case of Huntington's chorea, which is also a type of neurodegenerative disease. And next, what is the first clinically successful benzodiazepine? అంటే క్లినికల్ గా అంటే చాలా బెంజోడైపిన్స్ అనేవి ఉన్నాయి, బట్ ఫస్ట్ క్లినికల్ గా యూజ్ చేసింది ఏంటో ఒకసారి చూద్దాం. సో ద ఆప్షన్స్ ఆర్ లైక్ క్లోరజిపేట్ సోడియం, clonazepam, clorazepam, chlordiazepoxide. So chlordiazepoxide was the first clinically successful benzodiazepine. First clinically successful benzodiazepine is the chlordiazepoxide. You observe clearly, chlor containing chlorine, di 2, eza nitrogen, diazepoxide, diazepoxide. Okay. And next question is the beta carbolin is an example of. Beta carbolin is an example of. So the correct answer is here. Beta carbolin is an example of inverse agonist at the GABA A receptor. And it is not a agonist, it is not a antagonist, it is not a partial agonist. It is very, very important. Beta carbolin is a drug act as a inverse agonist at the GABA A receptor in the central nervous system. So agonist means mimics the action of physiological agent. Antagonist means oppose the action of physiological agent. Partial agonist means shows submaximal response of the agonist. For example, agonist 100% action, partial agonist 50% action. And inverse agonist means in the negative dose. So the response goes into the negative. So agonist 100%, antagonist neutral 0, and inverse agonist into the minus, inversion opposite to the agonist. Agonist means towards the positive side and inverse means towards the negative side. Next, jet lag remedies. So jet lag is nothing but the person suffering from the insomnia. So many people are having their business discussions regarding the intercontinents. అంటే చాలా మంది కూడా మీరు చూసుకుంటే కనుక వాళ్ళ బిజినెస్ రీత్యా వేరే స్టేట్స్కి వెళ్ళి రావటం, వేరే కంట్రీస్కి వెళ్ళి రావటం, లేకపోతే వాళ్ళ వర్క్ షెడ్యూల్ పరంగా వాళ్ళు నైట్ షిఫ్ట్ అట్లా ఉండటం వల్ల ఏమవుతుందంటే కనుక వాళ్ళ స్లీప్ సైకిల్ అనేది డిస్టర్బ్ అవుతుంది. ఆ స్లీప్ సైకిల్ డిస్టర్బ్ అయిన తర్వాత వాళ్ళు ఆ జెట్ ల్యాగ్ డిస్టర్బ్ అయిన స్లీప్ ని సరి చేసుకోవడానికి జెట్ ల్యాగ్ అనే రెమెడీ వాడతారండి బ్రాండ్ నేమ్ తో. దానిలో ఉండేది ఏంటంటే కనుక రామెల్టియాన్ అనే డ్రగ్ ఉంటుంది. దానిలో రామెల్టియాన్ అనే డ్రగ్ ఉంటుంది. ద రామెల్టియాన్ డ్రగ్ అగోనైజ్ ద మెలటోనిన్ రిసెప్టార్ అండ్ ప్రొడ్యూస్ ద కంఫర్టబుల్ స్లీప్. And oxazepam is a benzodiazepine, lorazepam is also a benzodiazepine, and taurine is a one of the inhibitory neurotransmitter in the spinal cord, like beta-alanine, GABA as well as glycine. So jet lag remedy is rameltian. Jet lag is the brand name. In that jet lag, the drug present is the rameltian, which is a agonist at melatonin receptor. Here, Phenobarbital is a drug of choice for. Phenobarbital is a drug of choice for. The correct answer is neonatal jaundice. So, neonatal jaundice name itself indicating that jaundice occur in the neonates. ఆ నియోనేటల్ జాండిస్ కండిషన్ లో ఈ ఫినోబార్బిటల్ యూస్ చేస్తారు. ఫినోబార్బిటల్ సెడేటివ్ హిప్నాటిక్ కాకుండా నియోనేటల్ జాండిస్ లో కూడా యూస్ చేస్తారు. బట్ నార్కోలిప్స్లో యూస్ చేయరు. నార్కోలిప్స్లో ఏం యూస్ చేయాలి? సిఎన్ఎస్ స్టిమ్యులెంట్స్ యూస్ చేయాలి. ఇన్ కేస్ ఆఫ్ నార్కోలెప్సీ సిఎన్ఎస్ స్టిమ్యులెంట్స్ యూస్ చేయాలి. వాట్ ఈస్ నార్కోలెప్సీ? పర్సన్ ఫాల్ ఇన్ టు ద స్లీప్ కంటిన్యూస్లీ. అండ్ అలాగే ఫినోబార్బిటల్ ఏడిహెచ్డి అటెన్షన్ డెఫిసిట్ యాక్టివ్ డిజార్డర్ లో అటెన్షన్ డెఫిసిట్ హైపర్ యాక్టివ్ డిజార్డర్ లో యూస్ చేయరు. అలాగే బులిమియా నర్వోజాలో యూస్ చేయరు. సో బులిమియా నర్వోజా అంటే హెపటైట్ డిజార్డర్. హెపటైట్ అంటే ఆకలి అనేది ఎక్కువ ఉంటుంది. బులిమియా నర్వోజా అంటే ఆకలి అనేది ఎక్కువ ఉంటుంది. అయితే ఫినోబార్బిటాల్ ని నియోనేటల్ జాండిస్ లో ఎందుకు యూస్ చేస్తారండి? జాండిస్ ఎందుకు వస్తుంది? బైల్ పిగ్మెంట్స్ పెరగటం వల్ల. అయితే ఫినోబార్బిటాల్ ఇస్ అ డ్రగ్ కెన్ ఇండ్యూస్ ద లివర్ ఎంజైమ్స్. వన్ ఆఫ్ దట్ లివర్ ఎంజైమ్ కెన్ break down this excess bile pigments and controls the jaundice in neonates. Phenobarbital is a CYP enzyme inducer. It can induce the enzyme which can degrade the bile pigments. And next, conscious center in the brain. The conscious center in the brain known as reticular activating system. Because of this reticular activating system, we are active in the daily activities, and due to inactivation of reticular activating system, we are sleeping in the night time. So reticular activating system RAS is known as our conscious center in the brain. And general anesthetic inhibit this reticular active system and make the person into unconscious position. సో జనరల్ అనెస్థెటిక్స్ ఏం చేస్తాయండి? ఈ కాన్షియస్ సెంటర్ ని డిప్రెస్ చేసి ఆ సర్జరీ అంతసేపు ఏం చేస్తాయి? అన్కాన్షియస్ లోకి పంపిస్తాయి. నెక్స్ట్, which of the following drugs are selectively useful for treatment of insomnia because of specifically acts on benzodiazepine 1 receptor? అంటే స్పెసిఫికల్ గా బెంజోడైపిన్ 1 రిసెప్టార్, బెంజోడైపిన్ 2 రిసెప్టార్స్ అని ఉంటాయండి. అండ్ హియర్ ఎస్పెషల్లీ జెడ్ డ్రగ్స్ లైక్ జోల్పిడమ్, జోల్ఎప్లాన్, జోపిక్లోన్ యాక్ట్స్ ఆన్ ద benzodiazepine 1 receptors, and in this category zolpidem is a drug. Zolpidem is the drug. అంటే this zolpidem specifically agonize BZ1 receptors and induce the sedation only. But benzodiazepines like diazepam and other drugs, they can induce the sedation, they can induce the amnesia, loss of memory, they causes unconsciousness also. But if person require only sedation, the drug of choice is the selective benzodiazepine 1 receptor agonist is the zolpidem. That is zolpidem. Okay. And next, date rape drug. This is the date rape drug. And especially the drug is used in the pop cultures. For example, by taking this drug, the person unable to recollect what is happening in the last night. For example, the bad people, they can try to harass the girls to rape them. So they can give this drug during the parties in the night time, and midnight they can do anything. So in that time, after she is recollecting, morning she is recollecting, she don't know what is happening. So she's thinking, okay, I am sleeping. Okay, so this is called as date rape drug, which is used in the pop culture. So what is the example of that date rape drug? Here options are diazepam, temazepam, ramelteon, and the drug is flunitrazepam. Flunitrazepam is a date rape drug. So in this condition, the person is unable to recollect what is happening because it suppress the hippocampus in particular period, and the person unable to recollect, and he does not know anything. He feels that, okay, I slept. And next, short acting barbiturate. In this class, the short-acting barbiturate. The short-acting barbiturate is the secobarbital. Secobarbital, pentobarbital, both are comes under short-acting barbiturates. Emobarbital comes under intermediate acting barbiturate. Phenobarbital comes under the long-acting barbiturate. Mephobarbital also comes under the long-acting barbiturate. Secobarbital, pentobarbital, short-acting. Phenobarbital as well as mephobarbital, long-acting. Emobarbital, butabarbital, intermediate acting. And thiopental sodium, methohexital sodium are ultra short acting. These are the ultra short acting. Identify the true statement regarding the benzodiazepines. So let's see. Let's see true statement. So benzodiazepines having similar mechanism with the barbiturates. అంటే బెంజోడైపిన్స్ బార్బిచరేట్స్ రెండు సెడేషన్ ప్రొడ్యూస్ చేసినా కూడా barbiturates are binds to active site of the GABA receptor. Benzodiazepines binds to the allosteric site of the GABA receptor. And both and benzodiazepine is a muscle stimulant. No, benzodiazepines are muscle relaxant. That's why diazepam used as a centrally acting muscle relaxant. Even your 2-2 pharmacology experiment, there is a determination of skeletal muscle relaxant activity by using benzodiazepine. Okay, used as a anxiolytics. Benzodiazepines can be used as a anxiolytic. They can reduce the anxiety. They can reduce the anxiety, especially lorazepam, diazepam like drugs. And anxiolytics also known as anti-anxiety drugs. Next, megaloblastic anemia is a side effect of barbiturates because barbiturates affect the folic acid synthesis. Folic acid synthesis. Folic acid synthesis. That's why barbiturates may cause the megaloblastic anemia. Benzodiazepine does not affect the folic acid synthesis, and zolpidem also does not affect the folic acid synthesis. So the drawback of the barbiturates is megaloblastic anemia. And drug of choice for alcohol withdrawal symptoms. Ante if a person suddenly withdraw alcohol, he gets some withdrawal symptoms like sweating, like tension, like tremors, increase suddenly BP, like that withdrawal symptoms can be observed. Ante alcohol ఆల్కహాల్ అనేది ఒక్కసారిగా తాగుతూ మానేయటం వల్ల కొన్ని సిమ్టమ్స్ అనేవి డెవలప్ అవుతాయి అనమాట. ఎందుకంటే డైలీ అతను ఆల్కహాల్ తీసుకుంటూ అడాప్ట్ అయ్యాడు కాబట్టి ఒక్కసారిగా ఆపేయటం వల్ల బాడీ రియాక్ట్ అవుతుంది. సో ఆ రియాక్షన్స్ దట్ ఆల్కహాల్ విత్డ్రాల్ సిమ్టమ్స్ కెన్ బి కంట్రోల్ బై యూజింగ్ ఎ డ్రగ్స్ లైక్ chlordiazepoxide. And chlordiazepoxide is a first clinically successful benzodiazepine also. And not a secobarbital, not a diazepam, not a fluperidol. Fluperidol is comes under antipsychotic category. Secobarbital is a short-acting barbiturate. Short-acting barbiturate. And acamprosate is an antidote or remedy for overdose of barbiturates. Generally, the specific antidote for benzodiazepine overdose is flumazenil, but barbiturates, initially there is a no specific antidote. Nowadays, drugs like acamprosate are using. And even for the overdose of barbiturate, the antidote is sodium bicarbonate also. So in this MCQs only, we discussed initially. Next, benzodiazepines on GABA receptors binds to the. So GABA receptors are ion channel receptors. Ion channel receptors are having subunits. In that subunit, the benzodiazepines on GABA receptors bind to the alpha subunit. Alpha subunit. Okay. And next, drug which is not metabolized in the liver. Drug which is not metabolized in the liver among the benzodiazepines. So here, oxazepam. Even you can remember by the mnemonic LOT, lot. Lorazepam, oxazepam, temazepam. These three are the benzodiazepines not metabolized in the liver. But the mentioned drugs like flunitrazepam, which is also called as rohypnol, 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 flunitrazepam, and also known as date rape drug. So the drugs not metabolized in the liver from the benzodiazepines are lot. Lorazepam, oxazepam, temazepam. Which of the following is not a sedative hypnotic? Which is a sedative and hypnotic. Correct answer is aripiprazole. Aripiprazole is a second generation antipsychotic. Second generation antipsychotic. And clonazepam is a benzodiazepine. Zopiclone is a non-benzodiazepine. Phenobarbital is a barbiturate. So aripiprazole is a mixed acting second generation antipsychotic. Second generation antipsychotic. So these are the few MCQs with explanation regarding the sedative and hypnotic. So please subscribe to our channel for more interesting information. If you are looking for drug inspector and pharmacist coaching, so you can join our platform Pharma Syndrome. Contact on 799-531-8103. So the notifications are ready. So definitely they will come, because in the state level as well as central level there is a emergency of the urgency of the election. So definitely there is a 100% chance of notification. Please be stick to the your preparation regarding the competitive exams. Otherwise, there is a lot of competition is there. You are unable to chase that competition. So if you are really looking for the competitive exams regarding government sector in the pharma, please be stick to the coaching as well as your preparation. For details, please contact us on 799-531-8103. So all the best. Thank you.